Welcome everybody to Caracon Symposium 2025. The fight isn't over. We're happy that you're with us. Before we get started on today's presentation, just a little bit of background. Caracol, we are Greater Cincinnati's HIV nonprofit devoted to positively changing lives in the fight against HIV through prevention, housing, and care. And today we're in the Zoom room, and hopefully we won't have the tech issues that we had yesterday for those who attended yesterday. You can find your audio here. If you want to engage with the audience, please use the chat for generalized questions. If you have questions for the presenter, please use the Q&A. We'll be using that, or we have people monitoring that, and we'll get those questions to the presenters. And of course, we'd like to give a special thank you to our presenting partners, the Midwest AIDS Training and Education Center and Hamilton County Public Health, for all the work they've done and all the support they've given in helping to plan out this week-long conference. I'd also like to thank our sponsor in Gilead. And then we have an exhibitor that we'd like to thank in Merck, and another exhibitor in ViiV that we'd like to thank as well. So thank you for your continued support of CARE Conference. We are offering continuing education credits for today's session. You must be in the room for at least 60 minutes, according to the Ohio Board, and you must complete the evaluation link that will be sent to you via the chat in the Zoom room. And when you exit the webinar, it should pop up as a link. That must be completed by 5 p.m. today to receive credits for today. If you do not get that link or are unable to capture it, you can email me at ariley@caracol.org, which I will put in the chat if you need access to that. So today's topic, which we are excited about, is advancing health equity for Black same-gender loving men in Chicago. We have Jada DeJesus and Pierre Sanders presenting today, and they're joining us from Chicago, so we're excited about that. And I'm going to go ahead and take my camera off and mute. I'll be in the background and let Pierre and Jada take it over. And thank you for being with us today.
All right. Good morning, everyone. As I mentioned, my name is Pierre Sanders, and I am the program coordinator for the Chicago Black Gay Men's Caucus. We're very happy to be here to present today, and I'll let my colleague come on and introduce herself if she's ready.
Hello, everyone. Okay, there's like a double echo. Can we hear me now? Hi, everyone. I'm excited to be here and present to you all. We are the Chicago Black Gay Men's Caucus. We have been around since 2005. We are the only nonprofit in the city of Chicago that focuses specifically on Black, gay, bisexual, and same-gender loving men. And there is a lot of intention behind that. I am the operations specialist at the caucus, but as many of you that either already work in nonprofit or have worked in nonprofit before know, we all wear many hats. And so one of the parts that I'm also involved in, as well as is Pierre, is a lot of the programming that happens and a lot of the interpersonal interactions that we have with people. The caucus itself, our main goal and ultimate mission statement is to advance health equity amongst same-gender loving men in Chicago. And we want to recognize that in advancing health equity, which we consider to be a holistic practice, by default, we will also reach the ability to eliminate HIV within our community. By really focusing on the person and individual as a whole, we recognize that that is going to be the main thing that really connects them to that service and any type of support that they need, whether it be treatment or otherwise. One of the things that I want to highlight, and you can go ahead to the next slide whenever, Adam. One of the things that I want to highlight about the caucus, again, is that we are the oldest and only organization in the city that focuses exclusively on improving the overall health and wellness of Black, gay, bisexual, same-gender loving men. This was an initiative that started in 2005 at the Chicago Department of Public Health. We recognized that well, not we, because I was, 10 at that age. But we recognized that there was just a lack of infrastructure when it came to making sure that Black, gay, bisexual, same-gender loving men were getting the proper health care and just adequate resources that they needed. And so they had started this coalition that slash task force that eventually became its own nonprofit. And so that's where we're at today. We have gone through many shifts and changes. Pierre and I have been here for the last 3 years at the caucus. And we have seen just an exponential amount of growth, both in the involvement, but as well as like the type of community that we're seeing. We have recently gone from, having events and certain things that we're doing in programming that has maybe like 3 or 4 people to now being overbooked, to having too many RSVPs, having to tell people, hey, maybe you should come to the next one. We have our own wait list. And it's been something that we have seen as a direct result, again, of recognizing and understanding the intentionality behind caring for an individual as a whole. One thing that we are very intentional about at the caucus is that Black gay men should not be identified as a statistic. They are way more than HIV, way more than AIDS, way more than the care and treatment that they need. And if we solely focus on them as a statistic, we're not going to get to the root of the problem. We're not going to eliminate HIV. And most times we're not going to be able to help them out just because we keep seeing them as what, the world sees them as. They're already struggling to engage in healthcare. They're already struggling to engage in, practices that are best for them in any type of social or societal matter otherwise, right? There are so many social determinants of health that weigh them down, whether it be racism, whether it be systemic oppression, whether it be, homophobia. It's a lot. And it's something that we've seen at the caucus throughout almost every single demographic of person that we've engaged with. And so we figured, okay, you know what? We've got to figure out, how do we get programming that all of these people can benefit from? How do we get things that everybody will want to enjoy? And how do we really just create a bigger awareness? One of the things, and you can go ahead to the next slide, Adam. One of the things that we truly try to, you can go. Yeah, there we are. One of the things that we, so you'll see it on here. So we are dedicated to improving health and wellness. Like I said, we are rooted on the south and west sides of Chicago. So in Chicago, I think I'm not sure where everybody is from. I know there's 68 participants, but in Chicago, there is several parts of the city, but predominantly, after surveys and different demographics have been taken, the highest affected population and vulnerable population to HIV specifically are on the south and west sides of Chicago. So that's really where we serve, and that's also where we're based out of. Just a second, my dog is barking at me to let them in the room. Sorry, I had to throw her a bone, literally. But one thing that I wanted to say and just make clear is that we are not a direct service site. A lot of the nonprofits that we work with and that we partner with, which is a big part of how we've also grown, is acknowledging the fact that we do not offer direct services as far as HIV testing, STI testing, treatment and care. That is something that we are known for being able to connect you with. Because there are already so many programs. There are already so many people that are offering a lot of the same things. But we realize that, especially with the current political landscape, being able to really connect with other partner orgs that we work with, as well as those close to us, but also those that are up and coming, and really just collaborating on certain initiatives, because we're all trying to really help the same community. Even though we focus solely on, Black, gay, bisexual, cisgender loving men, that falls under the umbrella of a lot of other categories. And some of those other categories also, fall under our umbrella as well. And so being able to have those connections and outsource those resources in that way, and just kind of, potluck all of what we have together, it makes it easy to not be a service site, but still have impact in the community when it comes to care. One second, these dogs are acting just a bit crazy. Pierre, do you mind talking just about the community that we've built and how we've tried to create a safer space?
Sure, absolutely. And it's through those community partners that Jana mentioned earlier, um, that we kind of developed or created this whole new family that we didn't know existed. We are all part of a group called the Shy Wellness MBS, Mind, Body, and Soul Shy Wellness Circle. And from that, we make sure we tap into some of those holistic needs: mental health, as well as spiritual care as well, and of course, physical. Just making sure that our community has everything that they need, but that they're in a space where they feel comfortable to just be who they are and express themselves and connect with like-minded person, and just feel safe. And Adam, I'm going to say we can roll to the next slide.
Okay, sorry about that. I'm back. They're still driving me crazy, so I might go off camera again and just transfer over to P, and you might see them moving in the background. But one of the things that we also just recognize at the caucus is that health is more than medicine, right? So one thing I said earlier, we don't want to look at the people in our community or in the community that we are serving as anything beyond. Sometimes we don't want to look at them as anything beyond, again, a statistic, right? A health number, an HIV test, or an HIV status. But the reality is that they're way more than that, right? And as we prioritize the individual and we prioritize the wholeness of that individual, we believe that then the entire community can actually benefit. We also support personal growth as well as emotional wellness and social connection. We believe that true equity means removing all of the barriers that are created and that exist right now when it comes to access and opportunity. We also believe that stability and advocacy are the key to thriving. One of the big programs and initiatives that we're pushing right now is our Caucus Hub, which is specifically for personal development, people that are trying to advance in their careers, whether it's, they've never held a job before, whether they are struggling to hold a job, whether they're already working and they want to advance and they're just feeling kind of like they're plateauing and they're stuck and they've got no guidance. We really do believe that figuring out a way to keep yourself stable, right? So thinking of, I'm not sure how many of you are familiar with Maslow's hierarchy of needs, right? But if your first bottom line needs of housing and employment and all of that stuff is not done, the ability to reach higher senses of just joy and self-actualization, it's likely impossible, right? You can't thrive, you can't be well, you can't care about HIV treatment, you can't care about whether or not you've taken your PrEP. If you don't have housing, if you don't have any type of stability, if you have nowhere to go and no one to turn to, right? So that's something that we recognize has to be taken care of and has to be really just reimagined as vital when it comes to healthcare, right? Another thing, we also design every program to make sure that people are feeling whole, supported, and seen. So making sure that what we're actually creating is what the program wants. The picture that we have down here is a group of men that we take to Alvin Ailey. So every year we do shows and we have different events that community has expressed interest in. One that has become kind of a tradition is the Alvin Ailey Theater Troupe. So that is something that people love. People are always coming out for. And again, we really use these types of programs, whether it be these single programs, whether it be something that is repetitive. So like we have our book clubs and movie nights and game nights and all that. We really use those programs kind of as like our entrance, right? And those are our foot in the door to say hello. And Adam, you can go to that next slide. So, like I was saying, that core belief is really that every connection is a connection to health. So while we recognize that all connections matter. So whether it be a resource, whether it be a conversation, whether it just be an act of care, getting out of the house, celebrating with somebody else, being social for a second, or sometimes it's a matter of coming to one of our events and getting free food. Some people don't have the luxury of being able to have dinner every night. So things like that, right? Recognizing that each one of those steps are going to be some form of care. Recognizing again that health and medicine, or health does not equal just medicine and diagnosis. That's not it, right? It's an emotional thing. It's a social thing. In the Black community, it's known to be a very spiritual thing. And realistically, in the climate that we're in, it's a financial thing. P, do you mind doing the last two?
Sure, absolutely. And so we have programs at Pathways. All of our program is a pathway to holistic health, as I mentioned earlier, with our mind, body, and soul health and wellness circle. We definitely try to make sure we're providing that support to those persons who can't seem to get it anyplace else. And as she mentioned, one of the things I've come to enjoy are our programmings like our book club, our flicks and chill and things of that nature, because you get to tap into um, a whole group of a family of people who all just have all these same interests as maybe one another, and they never would have known had the space not been created for them. And they feel comfortable always coming back and sharing and providing feedback, great feedback, and which we have some programming that has come out of that as well. Community enables care. When someone finds community and support, they move closer. And we certainly have seen that. We have found that persons who have attended our programming, be it here at our office or maybe off-site activation, um, definitely have become a little bit closer to us and reaching out to us and asking those questions. Hey, how can I get care and tested for HIV and other things like that? Hey, I'm having issues with housing. I mean, as Jada mentioned, though we're not a direct resource, we definitely created those relationships, not just to say, hey, here's a number, here's an address, but we also try to make sure we stay connected with them as well.
Yeah, for sure. I think that's something that we've seen a huge progress in is just being able to, again, develop rapport with each individual that comes in. Because once they start to kind of feel that connection, feel, okay, this place is safe. Now I'm asking you for help. Now I'm telling you that, hey, I actually think that the community really needs a HIV support group. Hey, I think that there's this person that I know and they're really struggling with, maintaining their PrEP schedule and taking their medication on time. So again, just really recognizing that all of these programs are going to be pathways to care. And you can go ahead to the next slide. Okay, so a little bit about how we engage the community. So, like we were kind of saying already, right? Creating those comfortable as well as relatable space. So, know that you're know that you're surrounding yourself with like-minded people, knowing that you're feeling welcomed every time we come. We are the familiar faces of the caucus. So, anybody that comes into the caucus, they know Pierre, they know Jada. We aren't faces that only exist behind the computer. Also, making resources visible and approachable. So we do post all of our resources on site. So anytime that anybody gives us anything, if you work for another organization and you're in the area and you have a resource or program, like a flyer or little cards, handouts, things like that. Always making sure that that's at the front when people are checking in to just have that engagement, right? So kind of like thinking of when you walk into a doctor's office and you see everything that they're offering. Even if you're not necessarily looking, you might just read it over like, oh, okay, this is more about type 2 diabetes. Good to know. And that's kind of how we hope that people are engaging with that table. And we see a lot of engagement, especially when we have those flyers and QR codes posted all around the office or just set out in the office for people to be able to take. Because then it also invites people as a kind of a warm invite where it's like, that we offer this, that this is offered. If you want more information, come to us, because we recognize that there's also is stigma, not only in asking for help, but asking for specific types of help. Again, using those events as entry points. So if you're coming to our game night, our Flicks and Chill, we partner with other organizations to have presentations on HIV care, on Apertude, on, what's going on in the community, on MPOX, things of that nature. So again, using those moments to kind of create the perfect opportunity. And you don't want to make it feel forced. You don't want to make it seem like, oh, every time I have to go to a game night, I also have to listen to a 35-minute presentation. No, it's not that. But at certain events, we will offer these things, or again, we'll use these as that lead way connection to really develop that rapport and build that trust. And then those resources and those referrals, they end up just following naturally. So again, once you prioritize those relationships, you start to be able to provide those services. And again, even at the caucus, we are not a direct service provider, but we have seen huge impact when it comes to people just needing care and asking for it. And another thing, we like to meet people where they are. So that means we like to laugh and have fun together. We like to have new experiences. We like it when you come in our office and you use our drop-in hours because you're going through a crisis and things are hard for you, or you're just bored and you need to change the scenery. Your home doesn't feel safe or secure. You don't want to be alone with your thoughts. But recognizing that, or sometimes you just want to drop in. Right? Sometimes you just like the community, you like friends, you like the experience. Maybe you need one of our programs, maybe not. But again, always leaving that open door has really allowed people to just develop that trust and honestly get curious about the programs as well as how they can get involved, because that's what we've seen as well as a lot of people then, pivoting to, okay, how can I volunteer? How can I get involved? Well, hey, I have this program idea. What do you think about this? Can I talk to someone? Absolutely. That's exactly what we're here for. And technically, a part of our mission statement is that we really want to center community-based leadership. So we want people to have the opportunity to really just develop as individuals, yes, but if they are also interested in developing within the Black, gay, HIV treatment workforce in any type of way, we are specifically here to make sure that, we offer those resources. You can go to the next slide, Adam. So and you can actually go to the next one because I think this might be a duplicate. Okay, yeah. So some of our core programs and initiatives that we have are the Caucus Hub. That's the personal development and professional development program that we have. That is something that we recently started. We are extremely, extremely happy with this. If you look on the top right photo, one of our participants there actually created his own queer conversation series that he was hosting at our office for a while. And this was an initiative that he thought of, and he was like, hey, I want to do this, but I want to be able to get paid. I want to make a living. Like, I want to involve myself in community, but I also don't want to, not have any personal advancement for myself if it comes in that way. Because the way that he expressed it was, I have this great idea. It's what community needs. It's a conversation series where we get to sit down, talk about what's going on in community, talk about what's going on in the world, be there for each other, support each other, uplift each other, have these engaging conversations. But I have nowhere to have it, and I don't know how to market it, and I don't know where to put it, and I don't know any other organizations that I can connect with. So I have this relationship with you. What can we do? And this has become a pretty popular series. It is something that he's now hosting, I think, bi-monthly, and he hosts it as well as different locations. And so it's something that he was able to work through and develop as well with our career development specialist, because he's also one of our Caucus Hub participants. We also, again, are helping people go back to school, helping those within the workforce also deal with burnout. Something that we also recognize is that these happy go lucky faces that are always here to help you are always going to look very welcoming if you're completely burnt out and you're at your wit's end. So maintaining that. We also have our social and cultural events. So game nights, flicks and chill, book club. We have theater outings, movie outings. We also have two really big events that are kind of known as like the larger community events and bigger parties, if you will. Skill-based and creative series. So we have financial literacy. So anybody that's learning, how to just manage their finances, whether it be credit. We had people coming to us letting us know, hey, I really got bad debt right now. How do I get out of this? Hey, my credit is awful. How do I get a better credit score? Or, hey, I finally have figured out my finances enough. I want to invest. I want to buy a home. And we were even able to actually get people from our financial literacy program to move on and actually purchase a home with the help of the advisor that we brought on. So that was something that was really cool that happened as well. We also did, if you look at the picture where everyone is bent over on to the right, we did a really fun dance class with one of the Alvin Ailey dancers, Joshua, who identifies as a Black gay man. And we just invited everybody to come. I think a lot of individuals have always thought like, oh, I'm really good at dance. I like to shake something, but I don't know if I could actually dance because I've never gotten the opportunity. And so that was a huge turnout, and a lot of people really enjoyed that. But again, like, we want to just continue to incorporate what people want. We want to give the people what they want and recognize that in offering them this slice of joy, this slice of happiness, they can start caring for themselves better, because that is an act of self-care, right? Going to a dance class, right? Going to a retreat in the woods, which is something that we offer with our partners, the Shy Wellness circle that Pierre was talking about earlier. And then we do also offer, although we don't do the direct services, we do also offer a free at-home testing kit that people can take. This has been something that has really taken the pressure off of people when it comes to having to sit there and test an office with somebody that you don't know. If you want to engage in the programs later, then it's like, okay, this person knows my status. This person was, helping me, either performing this test or giving me the results of it, whatever it is. No, we want to remain confidential. We want to have you be able to pick up the test, take it home, and be proactive with your healthcare. And we're offering incentive based after people are able to schedule a consultation with our doctor. Again, I'm going to keep saying partners because we have so many partners that we work with, but Onyx Medical Wellness Group offers free consultations to anybody that picks up an HIV test at our office and is taking it at home, wants to talk about the results, wants to talk about getting on PrEP, wants to talk about what happens next, etc. And again, community-driven design. So another thing that we have is our Caucus Core. So our Caucus Core is a community advisory board. There are people from community that are have been selected or referred to us as people that just represent the community, and we use them for a lot of our core programs. So anything that we're pretty much working on or creating, we pass it through them first. While the majority of our office does identify with the same community that they work in, we also recognize that we don't have the same lives, right? And so we have to make sure that we're taking into account how each individual is showing up and what exactly each individual needs, because what might not seem important to us is really important for someone else. You can go to that next slide, Adam. So at the end of the day, what really works for us, right? So leading with trust, building spaces that feels like home, embedding those health conversations naturally, right? Not forcing the conversation. I'm not trying to push a medication on you. I'm not trying to push this HIV test on you. I'm reminding you of how important you are. I'm reminding you of how deserving you are. I'm reminding you of how much you belong here. You deserve to be here. You deserve to have fun. And as such, you deserve to be healthy. You deserve to live a healthy lifestyle. Be proactive about your health. And if you need the help, we're here. We're going to offer that support. And sometimes we get it. It's not always that easy. So sometimes we also have to offer those incentives too, right? To get you to come. So for example, we offer a free retreat for men. We take about 40 men out every year to the woods in Michigan and do like a complete unplug mental, mind, body, and soul retreat. Offer these free books for anybody that's joining the book club, offer free movie nights. Again, all of our events are free. All of the stuff everyone has access to, and all of those resources that we also are connecting people to are also free. So again, when we have not only those incentives, but that community partnership with all the other organizations that are also offering these life-changing services, it makes helping those that we work with and work for much better. You can go ahead to the next slide. And then one of the last things, like I said, partnerships was such a big thing for us, especially this year, in these last few years since Pierre and I have been here. We have created the Chicago Methamphetamine Task Force in conjunction with SHARP, as well as Smile for Change, as well as the Chicago Department of Public Health. It is a task force that was created specifically to address the methamphetamine use within the Black gay community in Chicago. We did our own research because we realized that there was none available. We advocated for wellness campaigns as well as awareness campaigns to just go throughout the city. We partnered with CTA, so our transit authority. So we had our signs and our billboards on buses, on the sides of trains and things like that. It was really cool to see the stuff that we worked on. But we started this campaign called Don't Die High because our main goal through the Chicago Methamphetamine Task Force is truly harm reduction. We recognize, again, there are multiple reasons that someone may be using. We never want to shame anyone for what they're doing. We never want to judge anyone for what they're doing because we recognize that given the intersectionality of who you are as an individual, when you come into our space, there are likely things that you are dealing with that are not easy. There are sometimes things that you are using to cope. There are sometimes things you are using to have fun. There are sometimes things that you're using that truly just aren't any of my business. But I want to make sure you do it safely. I want to make you sure you do it with the awareness that you need, with access to the safety toolkit that you might need if you ever find yourself in trouble, or if you find yourself trying to indulge, but you want to do so safely, right? So key phrase, don't die high. If you're going to be high, don't die. Do it in a way where overdoses aren't affecting you. In Chicago, the population right now, I think 68% of overdoses in the city are black males, which is, I mean, just stifling to think about. You know what I mean? It's almost 7 out of 10 black men that engage with substances will overdose. And it's just not a statistic that we were comfortable with. And so we wanted to, again, be able to bring that to the community, because a lot of people didn't know that that was happening. A lot of people aren't engaging with that, and so they're unaware of the dangers. And so that was why we created the Chicago Methamphetamine Task Force, to really raise that awareness. And that, again, is with 4 or 5 other partners, including the city. And so that was a really big campaign that was very successful. We also have the Shy Wellness Circle that Pierre talked about, who does the yearly retreats. So those are amazing. We also offer physical wellness courses, mental health, and other community resources through them. We've partnered with Sway, which is a dispensary in the area. We recognize that, again, Black gay community is very much in love with their weed, and we love it. We understand that it is a holistic medicine that a lot of people have chosen to use. So again, if you're going to use it, let's make sure that we have all the information on how to use it. Let's make sure that we're getting it safely. Let's make sure that, we are getting our stuff from reputable suppliers, and that we're being educated on the benefits, the pros, the cons, the risks, all of that. Black Alphabet is another organization that we've recently wanted to work with. They work more so on the arts and entertainment side, which is not something that we find ourselves often in, but there's still that room for connection, because they have their own demographic of people. The Wellness Circle has their own demographic of people. Task Force has their own demographic of people. People interested in Sway have their own demographic, right? And so by doing this, we really just expand that reach to all the communities that we wouldn't be able to reach alone otherwise. And again, getting those specialized services. If we don't provide those services, guess what? I know somebody who does. And if that person doesn't know, then somebody who knows that person knows somebody who does. And it's what we have also realized is going to be the best way to maneuver burnout, especially in the political climate that we're in right now with everything going on. Things are so crazy that we really have tried to prioritize self-care in our office. And so one of the ways that we recognize we can do that is that a lot of the times we are all carrying the same caseload. And so figuring out how to share that, figuring out how can we divide and conquer with these resources, right? So one of our big events that we put on every year, Love Fest, has over, 350 attendees. Normally we plan it by ourselves, and we are a 3-person office, right? And so it's extremely hard sometimes to get something, off the ground, running and fully produced. But this year we said, you know what, why don't we join up and partner with other organizations, and we can just make it a bigger event. We can make it a different event. We can reach more people. We can tweak it a little bit so that we're not as burnt out, so that nobody else is as burnt out, because all of us are planning these same events. All of us are doing these same things, and we're all reaching different demographics because of who we kind of represent, or whatever image we have, or whatever the case may be. So back to those resources, let's pull our community members. Let's bring everybody together as one and kind of see where we connect and where we mix, right? Yes, you are absolutely right, and I do apologize for that. So, but what I mean to say is, within our community, we truly have found that there are many holistic benefits when it comes to weed. It's not something that we recognize as just a party drug, but I do apologize for saying that in the way that it was phrased. It was more insensitive, and I do apologize for that. But I do think that, like I said, we are a very friendly office we are a very 420 friendly office. I mean, we don't allow smoking in the office, but we do recognize that this is something that people have used as a medicine, and they use holistically, and they use for wellness, and it's been done and used for a very long time. And sometimes people aren't recognizing of what benefits it truly has, and they think, oh, I'm just using it, I'm just smoking to smoke. No, like, you're also smoking because sometimes this is helping your anxiety. This is helping your ADHD. This is helping you kind of get through your day and go through what these other social determinants of health that are weighing you down are. But you're absolutely right. There definitely could have been a better way to say that. So I do apologize. But yeah, so again, those partnerships are something that we absolutely do to just strengthen that trust and engagement with the participants. Because again, knowing that you know someone and I know someone, and I've done this program with the Caucus, but I've also done this program with the Wellness Circle, and I've also done this program with CDPH, and they happen to be hosting a program all together. Awesome. Let me go to that. Let me go there. I want to go to this because I know these different community members, and it's not just going to be, one or two people that I know. This will be a collective. And it feels, again, like there's that community building that really has helped us see the shift when we get into just finding out how to get people into the care that they need, because it is something that is scary to ask for. And it's not something that a lot of people in this community find access to, right? And whether that be because of personal stigma and trauma that has held them back from asking on what they need, or whether that just be from societal, right, influences that make them feel like they're afraid to ask for what they need, or maybe that they're just unaware, right? So pulling all of those things really makes that difference. You go to the next slide, Adam. That might be. But yeah, so here in this picture, we have a few of the different representatives of the organizations that we have worked for and with. This was at our event, Love Fest. We have Zahara Bassett, we have Darren Calhoun, Vaughn White, and Christopher Balthazar, as well as RED. These are some awesome people in the community. They have made big moves in just helping those in the community. But what we have tried to really just emphasize on again is reaching out to those in the community that are sharing your struggle. Sharing your struggle lessens the burden in every single way possible. And it's not just for the community members, that's also for us that work in these CBOs, that work in the nonprofits, that want to support these community members. If we want to do it as a whole, we're going to also have to work as a whole. And that's kind of what the Caucus has really been trying to continue, just as they continue our vision and our journey and continue to strive towards our mission statement, is just really connecting and supporting not only ourselves with other community members that have, needs and have the ability to, share our words and all of that and bring awareness to what we do, but also working within just the CBO realm and recognizing, again, we are all in this struggle. We are all affected by these budget cuts. We are all affected by some of these awful things that are happening in the news. There are a lot of atrocities and tragedies, some that are closer to home than others, right? And even the community members that may not identify as us, but still share something similar in the label of minority, right? We work together because together we thrive, truly. If we are able to pool our resources, to pool our support, to pool our love, and to pool ultimately what we have, it's how we believe at the Caucus that we can become empowered. So again, making those partnerships, making those connections, building that trust, both within your surrounding community organizations as well within just the community that you're serving and working within. But yeah, that is it. Thank you so much. Please let me know if there are any questions.
Thank you, Jada and Pierre. We do have a couple of questions that have come up that I wanted to run by you all and see what you've got to say about those. So the first one was, can you talk a little bit more about the employment advancement program that you have, how that works out?
Yeah,
thank you.
Yeah, no problem. So we have what's called the Caucus Hub. Like I said, so the Caucus Hub is a career development program that we created last year. It is powered by Vive Healthcare. Essentially what it is it is a workforce development program. So we are working towards helping people that work within the HIV workforce to address both wanting to move up in their careers or just have any type of development and growth. We give them guidance. We have them partnered up with one of our career development specialists, Doug Macklin. Dr. Doug Macklin. He is awesome. And he just helps guide people through what exactly it is that they have goals towards. How do they reach that sense of stability, as well as, not losing that sense of self, really figuring out what you want to do and how you want to get there, while also acknowledging that working in the community that we work with, it can be very, very difficult to, again, move forward and know how to do anything if you are burnt out, right? If you are frequently dealing with um, just oppression, you are frequently dealing with things that have made it harder for just to operate in everyday life, right? We are also individuals that are dealing with the systems that are in place. And so we have to recognize, or rather, we've decided to recognize that in order to help people grow, we have to help them rest as well. And so that's something that we do with that program. We also partner with CCHE, the Chicago Center for HIV Elimination. So the Chicago Center for HIV Elimination is created out of U Chicago. They're actually a program that focuses specifically on employment help, resources, things of that nature. So at the Caucus, we host 2 workshops monthly. So it's a 2-day workshop, and then it goes over any type of employment resources that people need. It kind of goes through a training. It's a pretty large or extensive program, I would say. And it is something that is specifically made for the Black queer community. It is something that is made to recognize, again, all these different social determinants of health and the intersectionality that Black queer men specifically face, and how that then affects their employment. Recognizing, again, that there are some things that do impact the community more than maybe their counterparts. And so making sure that actual curriculum is culturally affirming, and making sure that curriculum is truly in line with the type of community that we get coming through the door. So a lot of the times it is, right, X type of community, in the sense of you don't know what you're going to get. There are people that, like I said, can have 0 ideas on how to create a resume or write a cover letter. And then there can also be people that are, they've already written their cover letters and they're trying to get into a PhD program. And so we kind of help them along with those steps and figure out, okay, what comes next, while having, again, our career development specialist holding them accountable throughout that journey. And I personally also went on that journey myself, and I was one of the people that got to work with our career development specialist and applied to school. But yeah, it's something that we really have enjoyed. There have been a lot of people that are coming in to receive those services. And then we host like a happy hour every month as well with that, just to make sure that people are able to kind of get a moment to decompress from work and everything. I'm not sure. I hope that answered the question.
No, thank you. I've got a few more too. So we're getting some good questions. I've got a question that right now it says, how can community-led organizations be better at better supported to meet the needs of Black same-gender loving men?
I would say I mean, everyone always likes to say more money, right? More funding for the programs that we have, obviously. But also, I think that really one thing that we've seen make a difference is, so like CDPH is somebody that we work with at Chicago Department of Public Health, and they have made it their business to come into our offices, to hang out, to have site visits, just to see what's going on and to be involved with community. I think sometimes, especially for a lot of our grantors and things of that nature, they aren't fully aware of what's going on with community, or they're not super personally involved. So I think being able to just see that also offers some type of access to figuring out exactly what that support looks like. I think also, realistically speaking, the numbers game, right? So with CMTF, the task force that we created for methamphetamine use, we recognized that there were absolutely no numbers. There wasn't any data about how many Black gay men were dying over meth use. There wasn't any information about how many people were currently using, and what their experiences with using were, what those habits look like, if they were being safe, if they were HIV positive, if they were engaged with PrEP. So again, like being able to create those numbers and have those already ready so that we don't have to do the extra footwork, because we're trying to care for community, trying to create these programs, trying to, set up things that allow people to get the resources that they need, having to also then do data work or, survey statistical work that we felt should have already been done because it matters and it's clearly impacting community. It kind of puts a hindrance on us. I mean, it was great what we did. I'm so excited, and it was an empowering movement. But also it was something that we had to do, right? Because there was no data. It was almost as if, the powers that be, if you will, didn't necessarily think that that was something that needed to be collected because there wasn't any tracking on what was actually happening within the community. And so being aware of what's going on in the actual community, not just based off of, okay, these people have come in and, these are what their test results say, and this is what their health is saying, but actually pooling all that data, looking at the intersectionality of that, and being aware, just I think of what really is going on within community. And I know that sounds kind of vague, but I think again, so something that some of our grantees or grantors do is that they will come into our office and they will spend a day with us and they will kind of see what we go through and talk to us and figure out, what has your community been dealing with? What are these issues that you all are facing? What has worked for you? What hasn't? So just that transparency, I think, between, who's servicing the community and who's funding those services personally.
Thank you. That's great to hear. I think we've had that experience of our funders seeing the work up front and understanding it more, I guess. We've got a few other questions too. I've got one. What would you say are your most successful types of events? We're always wanting to get people in the door, but we feel like we can't hit the right event type for people to actually be interested.
So if you have the bandwidth, I think this is a great question. This is kind of where we found ourselves when we first started working at the Caucus, because Pierre and I were kind of like, nobody's coming to these events. What are we doing? What's going on? Is it the marketing? What's happening? And it was several factors, right? So one, we hadn't fully established what the events were that we were trying to have. Right. And then on top of that, we hadn't established what our pool or goal demographic was for those events. And so we were hosting these events with the expectation, okay, we want to bring young Black gay men in specifically because, the Caucus has been known in the past to usually offer services more to older men. A lot of older men usually come to the Caucus, but we have tried to expand that, and again, part of that is working with people. So Chris in this photo, he's from Task Force. That is a youth-based organization, specifically the oldest LGBTQ Black youth-based organization, if I'm not mistaken, in the west side of Chicago. And so partnering with someone like Chris, who already has those connections, is good. Another thing that we've done is, so when I say partnering with that, I also mean collaborating, right? So some of the events that we have are also hosted in collaboration with other groups, with other organizations. And I think that has made a big difference when it comes to who shows up, because again, really pooling those sources. But when it comes to events, I mean, you've got to be able to look at your community and also pool the community. Ask them what they want. What do you guys want to see? What will you show up to? Because if I'm continuously having book clubs and nobody's reading the book, we've got 3 people coming to the meeting, let's take it off the table, And those are hard conversations to have, because to us, sometimes it's well, we really worked hard. This was such a great program and it promotes literacy and it's da-da-da-da-da. But again, you want to be able to bring something that the community is actually going to be willing and wanting to get themselves involved in. I think that it's hard to gauge, but doing that survey data as well, right? So afterwards, something that we're trying to push for is being more intentional about knowing how people feel about the events that they did attend. So did you enjoy this? What did you not enjoy about this? Always leaving room for suggestions. But I think I think that those are two of the top things. I'm trying to think if there's anything else. I think it's really just a matter of, having a wide net of events. If you have the bandwidth for that, we haven't always had the bandwidth, but we tried to make it work. But like I said, we had financial literacy, movies, book clubs, game nights, happy hours, dance events, theater events. I would say, try to do what's a lighter load for you, but still is able to generate results, right? Because again, you don't want to burn yourself out, and partner when you can. There are several organizations that already have people that are coming to their events. So ask them, especially in your area. Say like, hey, what are the people really liking? Maybe Columbus, Ohio is known for its voguing, right? And so Task Force, for example, has a Vogue school. Okay, let's partner with Task Force. Let's get people to their event. While we're also at their event, let's tell them about what we offer, because maybe we offer the right things and these are the right events, but we're just not reaching the right people. So those are kind of things that I would say to keep it in mind. But we have definitely been there ourselves. So do not feel like you were there's something wrong with you all, or you guys are doing something. It's hard. It is hard. And it makes you feel like, why are we even doing this? What's the point? But I promise you, one day you'll get to a point where you're like, okay, we got to start putting a wait list up because this is too many people.
I think we'd all like to get to that point of a wait list.
No, ideally, right?
So we've got a couple other questions. I have one here. You had mentioned earlier in the presentation about how you all look at everybody from like a holistic standpoint. And I think you specifically said a retreat that you do in out in the woods kind of thing, and that there's a spiritual religious component to it. Can you talk about how that might intersect with some of like these public health messaging that you're giving, like HIV prevention messaging, harm reduction messaging, and not only how does that intersect with that, but also a lot of people in the queer community have some religious trauma. So how do you deal with that?
Yeah. No, and it's definitely a loaded question, and we'd probably need more than 9 minutes to answer. But it's something that, as like we've called it church hurt, right? So a lot of people in our community have dealt with church hurt. A lot of people have found themselves in situations where they are looking for a higher power to worship because that's part of what their identity was growing up. But, like you said, the one that they grew up with is also the same one that they got hurt in. And so it makes it really difficult. And maybe Pierre can actually speak a little bit more about the spiritual wellness partners. So within that Shy Wellness Circle, we have a group of spiritual wellness partners. So they are all Black, queer affirming religious men. They're either pastors or reverends. All of them, again, are either identifying or they're just queer affirming and allies. But it is something that we have tried to be really intentional about, specifically in Chicago, especially on the South and West sides. A lot of people grew up with church. A lot of people that we see, that we work with, still have heavy connections to God, to spirituality, some people to Buddhism, Hinduism, or Islam, I'm sorry. But I think that there has been a big shift in recognizing the connection between spirituality and this particular demographic that we work for. And I'll let Pierre, like I said, answer to that a little bit more if he can.
Yeah, absolutely. Excuse me. I think one of the most important things are having leaders in place who look like the community and are a part of community and have experience as well. One of the leaders who has shared their story is a 30+ year HIV survivor. And I think having that kind of connection, those type of people in place, it definitely helps bring the community back together and begin to deal with that past experience of, this happened to me and this happened to that. And, it's not necessarily, I'm not mad at God, I'm just mad at the people in general. And so you kind of begin to process that and break that down. And I think that's important. We have faith works LLC, and of course Pride It Infuse, and then our ally organization would be You Be the Cure with Dr. Ulysses Burnley. But having those persons who look like you and can actually identify with the experience is what's important.
Thank you for that. We still got a couple more questions. So one of them is, in your opinion, how do social determinants of health, such as housing, employment, and access to healthcare, uniquely affect this population of Black, same gender loving men? What are some of the unique, I guess, probably intersections that you're dealing with?
Jen, if you're talking,
Oh, sorry. I was trying to read it, but then it goes away in the chat. I'm trying to figure out where to click on Q&A. But I think the social determinants of health, it's kind of like what I was saying earlier, right? So if anyone is familiar with Maslow's hierarchy of needs, it is essentially this pyramid that kind of talks about the different layers of what needs to be done to reach self-actualization or enlightenment, right? And maybe not all of us will end up becoming enlightened, which I'm totally fine with, but we all kind of want to the goal ultimately is to move up on that pyramid so that you can enjoy social relationships, you can enjoy love, you can enjoy your life, you can do the things that you want to do and be able to take care of and support yourself, but still have time on the side to, live out your dreams, if you will. And so the baseline of that, again, is housing, employment, food, and some level of stability. And so those social determinants of health, when it comes to like housing, make it really, really difficult for people to then move up or have the experience of, okay, say they are very lonely, right? And they want to have friends, they want to have partners, but they don't have stable housing. It's very hard to bring someone over, whether it be to hang out or romantically get involved if you're living in a transitional home. So something like that, right? Or for example, when it comes to employment, a lot of people like to go out, a lot of people like to spend money. And so if you don't have the cash to do that, you don't have the cash to spend out. We have heard people be like, okay, well, stay your broke ass at home, right? And those are literal conversations that we hear, and they end up, they end up hurting people. But the reality is that it's not their fault that in most cases, right? It's not their fault that you don't have the stability, that you don't have a full-time job. You're likely dealing with something that's deeper than that, right? So one of the things that we deal with a lot, especially is making sure that, not making sure, I'm sorry, but we deal a lot with people that are dealing with substance use issues. And so that is, or alcohol, and including alcohol addiction as well. And so this is something that we have realized has really hindered their ability to be stable, which then hinders their ability to care about their health care. And so, for example, we have had frequent situations where people are not able to hold down jobs, and they cannot, they are looking for rental assistance, or they might be getting evicted, or they might be dealing with some type of program or situation like that, and they're, in between jobs. And when we try to hit on those conversations of, hey, like, here's this free HIV testing kit, or here is this information on PrEP, or hey, we're offering free consultations and free Mpox vaccines down the street if you wanted to get them with Alliance Care. They aren't conversations that truly can be taken in because there's so much pressure and weight from everything else that's kind of going on, that it makes it harder to really focus on that internal healthcare, right? So when it comes to being able to actually just live against the social restraints that society has already put on a lot of this community, and adding on top of that, that you have this thing such as your healthcare that doesn't feel, that should, right, feel like a right, should feel like something that I should absolutely be being proactive about. Instead of that, it feels like this extra task, on the top of the fact that I don't have groceries, on top of the fact that I don't know how I'm going to get to work, on top of the fact that now I'm afraid I'm going to lose my job. Now I'm afraid I'm not going to have housing. I don't have family that I feel comfortable moving in with. I don't have community that I can reach out to. None of my friends have the money to help me. And so now, what do I do? You want me to care about this HIV test? You want me to care about getting on PrEP? It's not even within my capacity, right? And so that's kind of how we view it, is recognizing that in order for the community to be able to take care and be proactive with their health, they have to be at a certain level of being okay, right? They don't have to be great, they don't have to be thriving, they don't have to be amazing, but they have to be okay enough to understand that it is both within their agency and their right to be well. And so that's kind of where I think we kind of fall on that. I'm not sure if that fully answered your question, but let me know. I think that's how.
Thank you. And
Mhm.
you had mentioned what I think is something that's kind of a best practice, that you have I can't remember what you called them, a core group. It's kind of like your advisory group. Um, can you talk about how you use that group, like kind of what you're using them to inform, and then how you determine membership? Like, is there like an application process, or do they need to have certain lived experience? And how do you engage with them? Like, are there incentives, food provided, that type of stuff?
Yeah. And I think P can also jump in and talk about this a little bit as well. But so the Caucus Core is the community advisory board that we created. I think at this point, like 3-4 years ago now, right when we had started, they came about, and it was something that the goal was really just to implement, again, like community-based opinions on the programming that was being developed. And so when we have our quarterly, or I think it's quarterly meetings that we do with the core, we go over all the things that we're doing. We go over programs, whether we have incentives for those programs, what the dates are, what the themes are, what the kind of goals are, if they can and give us any advice or input. We always are also looking to use them for resources as well. They might know, who's the best mixer or, DJ in the community, or this is an up and coming artist that we know of. We would love for them to, do a performance at your next event. But so just kind of things like that, where we're really just, again, like really just using them mainly for not only opinion, but intel on what the community needs and that type of knowledge. And then P, you can feel free to add anything else, and then let them know about how.
Yeah, absolutely. That's exactly what they are. They're all kind of leaders in their own groups. They are mostly all professionals. And so if we're having an event or things we may not hear about, as we mentioned, we're only a small staff of 3. We can only be so many places. So we kind of lean and depend on them to kind of say, hey, this is what's happening. This is what's going on. And one thing I want to mention, this is completely voluntary. They are not incentivized in any way. So and there is an application process, and that's because you want to make sure you have people who genuinely, truly care about the work, and what we're trying to do here. Wish that we could incentivize them, and maybe one day, that may be able to happen. But these are all representatives throughout the city of Chicago, different fields. And we try to keep it across the board. We have some younger ones, some quote middle age, whatever that looks like now, and some on the other end of things. But just having that balance and that diverse group really just help us stay in the know and what we need to do as an organization.
Thank you. I think we're past time, so that's probably a good place to end. But thank you for going through all of those questions and going through all of your programs for our audience today. I think it was great.
Thank you.
Yes, thank you. Thanks for
Thank
being
you,
here.
everyone.
Yes, thank you, everyone.
Yeah.
Take care.